Hey guys, Dr. Stephanie here, and today we're going over 5 exercises that can help get rid of your knee pain. So we're talking any kind of knee pain. If you have knee pain in the front of your knee pain at the side of your knee pain at the back of your knee, if you only have knee pain when you're sitting, if you have difficulty walking up the stairs because of knee pain, all of these exercises will help your knee pain no matter what the cause of the knee pain. And I know there are a lot of causes, and sometimes there's no specific cause. Maybe you didn't have an injury, you didn't have an accident, you don't know what causes your knee pain, but your knee hurts. So, usually, when you're treating knee pain, the goal is to look for impairments like what muscles are weak, what muscles are tight. And in a lot of cases, the hip muscles, especially the glutes, the gluteus medius, this muscle in your hip and butt area that does kind of the side to side motion, that muscle tends to be weak. So we usually focus on strengthening that muscle, strengthening all of the other muscles in the hip, the ones that rotate the hip as well, and also working on these quad muscles because obviously those support the knee, working on the hamstring muscles, those also support the knee, and then working on muscles in the lower leg and foot and ankle. So basically, it's important that your whole leg be strong, that your whole leg be mobile, that it moves like it should, and that can help get rid of your knee pain. So we're going to go through these 5 exercises. You need minimal equipment. You can do all of these at home. You can just grab things you have at home. The only thing you might not have is a band, so you just need like a loop resistance band like this. You can also do it without this. This just makes it a little bit more challenging. Okay, so exercise number 1 is pretty easy. It's a sit to stand or a chair squat, and I'm going to show you 2 ways you can do it. The first way, so you're going to stand in front of a chair, or you can do it at your couch, wherever you can kind of sit down. So you're just going to squat to the chair or just sit down in the chair and then stand back up. And you want to make sure you don't use your hands, because if you use your hands, you're not using your lower body like you should. Now, if you try and you can't do that yet, it's okay to use your hands for support and then gradually work up to using no hands. But the goal is to use no hands. So you can just sit down slowly and stand up slowly. And then if that seems pretty easy, you can just sit down, tap the chair, and come back up. So don't put your full weight in the chair. Just kind of squat to the chair and stand back up. Also, if that feels too low, you can use a higher chair or stool or whatever you have, or just kind of go halfway and then come back up. Then we want to progress it to single leg. So you're going to lift one leg up and sit down in the chair with one leg and then stand back up. So if you're doing this, you're going to want to do one side and then switch to the other side and do a sit and a stand back up. All of those exercises, 2 to 3 sets of 10 on those, whatever you feels challenging for you. So if you get through 2 sets of 10, you're like, oh, that's not too challenging, I would add another set. Now, if you get to the end of the second set and you're like, oh man, I can hardly do another one, stop there and then progress to the third set when you're ready. Okay, so let me move this chair and we're going to go on to the exercise number 2. We're going to grab a yoga block, but you can actually do this on your stairs, or you can grab a book, or if you have an exercise step, something you can step up on. So you're going to stand on this step, and we're going to do what's called a lateral step down. So you're going to stand here, and then you're going to tap this heel to the floor and come back up. So tap down and come back up. We're going to keep our weight on this leg and just barely tap this one to the floor and then come back up. So we're working on our balance here. We're also working on glute strength. So you're just going to tap and come back up, tap, come back up. If you need to hold on to something, you definitely can. But this is really working, and you'll feel it when you're doing it, really working on that balance and that glute strength there. Again, 2 to 3 sets of 10 is kind of a good goal for that one. Okay, the next one seems pretty simple, but it's a calf raise. So you're just going to come up onto your toes. And this seems like an easy exercise, but it's important that we strengthen our lower legs, our calves, and also the front of our lower legs in order to support the knee. It's just as important as strengthening your hips. So you just come up and down. Make sure you go slow You want to come straight up and straight back down. And then when this, or if this feels pretty easy in the beginning, sometimes it feels easy and then you get to 20 of them and you're like, oh man, that's not as easy as I thought. But you eventually want to progress to one leg. So just coming up and down on that one leg. And then you're really working that calf muscle. If you feel like you can do that now, you can actually do both of those. So do maybe 30 calf raises here, and then do 15 to 30 on each leg. And you can definitely hold on to something if you need to. But that's really working on strengthening those calf muscles. Okay, now we're gonna grab the band. So this loop band is going to go around your thighs, right above your knees. And there's a ton of things you can do with this, but what we're gonna do is kind of a side step to what I call a runner or a knee drive. So you're gonna bend your knees slightly, keep a little resistance in the band. You take a wide step to the side, keep your feet pointed straight, and then bring this leg up. So you're gonna drive this knee up towards your chest, and then step to the other side, drive this knee up. So this takes some balance, definitely. So we're working on balance, and we're working on glute and hip strength here. So side step and knee drive, side step and knee drive. When you step to the side, you want to step into a squat here and then drive your knee up. So we're just going back and forth. You can do 20 to 30 of these, or I sometimes like to time these so you're not focused on counting. So I would do this about 30 to 45 seconds, and then you can repeat 2 to 3 times. Okay, so then we are going to place this around our ankles, and I'm going to show you on this one, if this one's too tough at the ankles, you can actually move the band up to the knees just like we were doing. Okay, so we're going to stand, a little resistance in the band, knees slightly bent because you don't want to lock them out here. And you're just going to bring this leg out to the side in a hip abduction and back together. So out to the side, back together. When you bring it out to the side, you'll feel your body shift a little bit, but you don't want to lean too much. You want to try to stay straight up and down. You're just going to lift out to the side. So again, we're working on balance, but we're also working on hip and glute strength. Really getting that gluteus medius muscle. So about 20 to 30, and then you'll go ahead and switch to the other side, and same thing. Just kicking out to the side here, not too fast, not too slow. Keeping that leg straight. You can keep the knee bent a little bit if you want to, but you want to make sure that the whole leg is kicking out to the side straight and keeping your feet pointed straight ahead. Okay, so those are 5 of my best exercises for decreasing knee pain. Also, if you don't have knee pain, those are great for just building hip and full leg strength, and that can help prevent knee and other injuries in the future.